Hi guys, how are you all? Hope you are fine. Hope you all are enjoying, and my blessings are with you all. My best wishes are with you all. May God bless you always and forever. Myself, Dr. Sonali Patil, extreme feminist comrade, Dr. Sonali Patil, liberal. Today I had came in front of you by a different topic in front of you, which is a major topic, but I had came in front of you. I had summarized it in a very short way. So today in my clinic, I was having one patient which was having a swelling and inflammation of the legs, edema on the legs, pedal edema was there, not pedal edema, swelling was there. So what suddenly I thought about the differential diagnosis, like it may be deep vein thrombosis, it may be cellulitis, it may be filariasis too. So as the term filariasis clicked my mind, I thought to make a video on the anti-helminthic infections. So let's get started. What are helminths? Helminths are the different kinds of worms in our body. They are divided into nematodes, termatodes, and cystodes. So what are nematodes? Nematodes are like pinworm, hookworm, guinea worm, threadworm, then scabies, filariasis. Then termatodes. Termatodes are like lung fluke, liver fluke, blood fluke, intestinal fluke. Cystodes like Tinea solium, Tinea saginata. So this type of helminthic infections, they are treated by antihelminthics. Now what type of antihelminthics? Antihelminthics like albendazole, mebendazole, which we are commonly using in our practice, ivermectin, parental pamoate, tetramazole, levomazole, so thiobendazole. So these are all kind of antihelminthics which we use for to treat the anti-helminthic infections in our body. Now, what these actually what parental pamoate is a drug which causes spastic paralysis of the worm, and whereas mebendazole, albendazole, they cause flaccid paralysis of the worm. Now, how we will see it? First, albendazole, mebendazole, they they get stuck to the worm, and they stuck to the beta tubercle in the worm, which causes decrease in the glucose level in the worm, and due to lack of glucose there will be lack of energy in the worm, and the worm will die due to the worm will die due to lack of energy. And this type of death of the worm, it is the flaccid paralysis of the worm. So such kind of albendazole, mebendazole, they cause flaccid paralysis of the worms when given for the treatment of the helminthic infections. Now we will see what parental pamoate does. This parental pamoate, they causes spastic paralysis of the worm. They hit the nicotinic receptors in the worm, and as the nicotinic receptors are captured, there will be there will be increase in the depolarization rate, and the worm will die due to spastic paralysis. So we should not use parental pamoate along with albendazole and mebendazole, because one causes spastic paralysis, one causes flaccid paralysis, and the both will neutralize each other, and the drug won't act on the worms. So both the combinations we has to avoid. Now we also use the one of the commonest drug in our general practice, which is called as the diethyl carbamazine. What this diethyl carbamazine does, the diethyl carbamazine, which are also given in the pulmonary eosinophilia and filariasis, it causes immobilization of the worms due to the by this defense mechanism. Then one more drug is there which is called as ivermectin, which causes flaccid paralysis of the worm, and it is also used in the scabies sarcopte infections. So this was all about the nematodes and the treatment of the nematodes. Now treatment of the termatodes, like we are using the drugs that is a praziquantel. What praziquantel does? Praziquantel, these drug is used in the treatment of the termatodes. It causes spastic paralysis of the worm because it increases the calcium influx in the worm, thereby increasing the depolarization rate and causing the spastic paralysis of the worm, leading to death of the termatode. So praziquantel is the drug. Now treatment of cystodes, Tinea solium, Tinea saginata, albendazole and praziquantel both can be used in the treatment of cystodes, either of them. Now there is one type of reaction. What are the side effects of anti-helminthic reactions? Anti-helminthic reactions, their side effects, they are like, first are the hypersensitivity reactions, then there might be nausea, vomiting, there will be epigastric distress, there will be loss of appetite, there will be headache, dizziness, nausea, vomiting, insomnia, mental confusion. But what I want to tell you is that in when we are giving this antihelminthics like diethyl carbamazine for more than 7 days in a patient, what happens? What happens when the diethyl carbamazine in the patient we are giving for more than 7 days in the patient suffering from helminthic infections? This DCC, that is diethyl carbamazine, they kill the parasites in our body. But if it is given more than 7 days, then this death parasites, no, the parasites which causes death due to uh, this diethyl carbamazine, they release one type of protein is released by their body, by the dead body of the parasites, and these proteins cause a reaction which is called as a Mazotti reactions. These Mazotti reactions, it leads to fever with chills, rigors, there will be confusion, there will be mental confusion, there will be nausea, vomiting, urticaria, there will be cyanosis, there will be chest congestion, there will be uveitis, keratitis leading to blurring of vision, there will be leukocytosis. So this was about the Mazotti reactions. When we are prescribing antihelminthics, we have to be very careful about the dose and the repetition of the dose of the antihelminthics, because they may also lead to one kind of hypersensitivity reactions and also complications like Mazotti reactions. So this was in short about the helminthics. So hope you like my video, and if you like it, please hit the button like and subscribe my channel. Thank you so much. Love you all.